go to the front line, see what they're seeing, ask them what they're seeing, and ask them as the experts in what they do every day, what's wrong? What's getting in the way? What are the barriers? What are the frustrations? What are the time wasters? What are the things we don't do consistently well enough? Someone I know has the expression, what's the pebble in your shoe? You know, what is that sort of irritant, right? That we could remove potentially and probably make your job easier, as well as make the patient happier and healthier. Certainly, if you want to make anything happen with the patient, if you want them to walk away with some information, if you want to influence their behavior, if you want to influence their perception, the people that are there in the room with them obviously need to be a part of that because they're the ones that can drive it. Once again, that's your frontline staff that can really carry that torch. I think patient safety is an area that is very easy to engage healthcare staff around. It's something, it's the thing that got, in my opinion, as a non-clinician, it's probably the thing that got most of them into this work in the first place. It's very easy to get a very passionate group of people very focused around problem solving when it's patient safety. Not so much when it's supply expense, maybe. Great area, I think, to start in. Also maybe very complicated and difficult one. So the struggle there, or the challenge there is finding a small place where you can start. You can't start a big fire as a big fire. It starts as a small fire. I think that's an important thought. So if you can pick topics, pick subject areas that are more likely to spread on their own, again, by engaging people around the things they're passionate about, engaging people around things that will improve their work experience as well as their patient safety and their patient's experience, I think that will help. A lot of reasons why you can't get nurses to leave the floor, in particular. And what I've found is if I did the work on their behalf, it wouldn't stick. They really needed to be part of it to get it to happen. If you set up the project well, if you get the right people in the room, again, as we were saying earlier, if you don't rely on sort of the usual suspects to get into the room and come up with some answers, if you actually get your frontline staff involved, I think then you create an opportunity for them to be innovative. Because number one, you get them engaged, and number two, if you are successful in making them feel, I guess, safe to participate, right? Safe to share their thoughts, make a suggestion even if it doesn't turn out to be all that great of a suggestion, not be afraid of failing. Maybe then you've sort of paved the way for some potential innovation.